In our society, tens of millions of people experience mental health symptoms at some point in their life. Studies show these numbers are even higher for individuals with intellectual and developmental disabilities. This may be due to social, environmental, and psychological factors, which contribute to an increased levels of stress. The Schreiber Center is a valuable resource that focuses on the emotional and mental health needs of adults with intellectual and developmental disabilities. We are dedicated to helping people reach their goals and live happy, healthy, and independent lives.
I'm so scared. I know people are talking about me. I don't know if I can live like this anymore. Maybe if I board up my windows, they won't try to get in.
Are you noticing significant changes in the functioning of a loved one or someone you are supporting with an intellectual or developmental disability? That might be a sign of a mental illness.
My son was living in an institution for many years and is now living in the community with support. He's so tired all the time and he seems wobbly and over-medicated. His medication was reviewed so that we can see if there's anything that can be done to help him.
Some examples might include changes in eating or sleeping, changes in mood, loss of interest in work, hobbies, or day program, bizarre behavior or thoughts, frequent nightmares, high levels of stress, paranoia.
I'm actually very concerned about one of my clients. She lost her father a few months ago, and since then she stopped calling, and she's been missing a lot of work and is actually at risk of losing her job. When I visited her yesterday, she looked like she hadn't showered in days, had lost weight, and was saying she was hardly sleeping. I'm not sure what to do.
If they are 21 years or older, reside in Alameda County, and are a client of the Regional Center, the Schreiber Center can help. Once referred to the Schreiber Center, we will begin an assessment of their mental health needs and determine their eligibility for specialty mental health services. If they are found eligible, they may receive psychotherapy, case consultation, and medication support. If this is not the right resource for them, the Schreiber team will do their best to direct you to others who can help. Call us before the problem becomes a crisis. Early identification, prevention, and intervention is always the best course of action.
I called the Schreiber Center and they were really helpful. They reviewed my client's insurance, took my referral, and completed a thorough assessment of her situation. She is now receiving counseling from a wonderful therapist, and they didn't think she needed medication at this time, but will continue to support her. In just a few months, she's looking a little better and didn't lose her job.
I met with the Schreiber team with my son. After a thorough medication review, they slowly worked on eliminating 2 of the medications he was taking. He's so much more alert and he's doing well emotionally. He's even interacting with his friends and family more. I feel like I have my son back.
My case manager took me to the Schreiber Center, and I was really nervous. The counselor is nice though, and even if she asks a lot of questions, I still feel safe with her. We are taking art and talking each week, and my psychiatrist gave me some medication that might not help me feel scared. I'm still a little nervous to leave the house, but I'm feeling better every day.
These are some examples of the types of referrals the Schreiber Center receives. We are here to help. Don't hesitate to call us. Remember, preventing a crisis benefits everyone. Schreiber Center, growing together.